In the meantime, we want to bring Brandi Kruse into all of this because clearly hospital staffing is a big concern as well. I mean, maybe even more so when we're getting closer to that October 18th deadline when it comes to getting vaccinated and then facing a job loss if they don't.
Yeah, so we know that the state's vaccine mandate includes about 400,000 public and private sector healthcare workers. We don't have exact numbers on how many are still unvaccinated, but if you kind of use an educated guess and say, let's say it's similar to the general population across the state, you could be looking at about 25% of those 400,000 people who don't have a vaccine yet. And as we heard from the Secretary of Health just a bit ago, it is something that, or in terms of the staffing as it is right now, even before the October 18th deadline to get a vaccine comes, staffing is already a problem.
Staff shortages are a real concern, and that is something that's concerning to all of us. That means that staff beds and overall the system capacity is absolutely an issue, and we are concerned about that as well.
So, of course, there's this question about, okay, if the October 18th deadline comes and goes, and then October 19th comes, and there is, the state makes good on the threat, the private sector has to follow through and fire healthcare workers and hospital workers who are unvaccinated, where will that leave the healthcare system? It's this really challenging push and pull between, we talked about the importance of vaccination to save people's lives, but also obviously having hospital workers is also important to saving lives. So how do you achieve those two goals at once? We obtained some emails from the beginning of August when the state was trying to figure out its vaccine mandate. And this push and pull between the public and private sector was something they struggled with. Here's an email from the senior policy advisor on public health to Governor Jay Inslee, sending it back and forth with the Attorney General's office, with the Office of Financial Management. She said, I'm wondering if we leave out explicitly calling out the private healthcare facilities needing to fire employees, but leave it somewhat vague on the repercussions in the private healthcare space. Leave them an option to shift a worker to telehealth or something if they want to. So she was basically suggesting at the time, should we not dictate that the private healthcare industry fire people who don't get vaccinated, maybe give them an option to, do appointments online just to keep them in their jobs, essentially. And I will say, if you're interested, we got a lot of really interesting, eye-opening information out of this public disclosure request. You can read more of our story on Q13FOX.com. I will also warn you, though, if you take a look at this, a lot of it looks like that too. Yeah, and it's tough because you have a lot of this that has to do with legal interpretations for the mandate, for religious exemptions with the Attorney General's office and the governor's office. And so, attorney-client privilege, they still got that at the state level as well.
Yeah, I didn't think about that, but like you mentioned, the governor or the state is technically the client. So.
Yeah, I mean, we pay both the attorney and the client in this instance, but they're still allowed to redact things under state law.
All right, Brandi, thank you.
Yeah.